Commonly, people with scoliosis end up with tight hips. This lack of movement in the hips pushes more movement up into the spine, which begins to chew up the spine and cause pain. Now, we don't want that, so I'm going to show you how to open up your hips in what we call external rotation in the PT or physical therapy world. All right, imagine you're on a clock face. I've got 12 o'clock pointing at you, and I've got 4 o'clock back here. I'm going to take a step to 4 o'clock, and then I'm going to come back. Now I'm going to step again. This time I'm going to lunge out a little bit further. This stretches both of my hips into external rotation. To make the stretch a little bit more, I'm going to use my hands. So I'm going to put my hands at roughly at shoulder height. I'm going to look at my hands, and I'm going to turn them as far as I can. Now, the actual stretch for the hips is perfect, but we have to be careful a little bit depending on what type of scoliosis we have. We might not want to take the hands so far this way. In fact, we might want to leave the spine where it is. And we do that by simply placing our hands in a fixed position and holding them there as I step. And so now my spine doesn't move, but I still get a rotation in my hips and I get a counter rotation up into my back. And so we use that to help correct the curves in the back at the same time as opening up the hips. But where you put your hands will be specific to what type of curve you have.